Hi everyone, we're just going to wait for everybody to join. We're going to be talking about baby bottle tooth decay, which is a very favorite topic for a lot of mothers because they're very worried about their one's teeth even before they start coming in. Hope to be able to answer all your questions. We'll wait for a minute more and I shall start. Okay, great. So hi everyone, I'm Dr. Ipshita Suyash and I'm a pediatric dentist, also known basically as a kids dentist. I have a practice called Toothish, which is a holistic practice for children in Khar, Mumbai. Not only do I deal with teeth, but I also deal with the breathing, sleeping, and eating patterns of children. I'm also a myofunctional therapist. Today, I'm going to talk about baby bottle caries, like I said. Before we get into teeth, I would want all the mothers to know that it's not just the teeth that I will be talking about. I will also be talking about certain habits because of the bottle which develop, which hampers the teeth of the child. Yeah. So, baby bottle tooth decay is a name which is now known as early childhood caries or nursing bottle caries. What really happens to the teeth is that there is decay that sets in because of certain feeding practices that are followed. Now, it's not just the sugar which is the criminal for cavities, but it is also any kind of food which, if stayed back on the tooth of the child, it will cause cavities. Yeah. So in babies, because bottles are used to feed them, especially at night when they sleep off, and they sleep off having milk, the milk stays onto the teeth of the baby. If that is not cleaned up, there are certain germs which are there already in the mouth. But when there is food, they produce kind of an acid which develops in the mouth and it destroys the tooth or the whiter coating of the tooth, which you say, which is called the enamel, and that slowly becomes a hole and it then starts causing pain to your little one. So this is how baby bottle tooth decay starts. So first of all, ensuring oral hygiene for your baby is most important. Secondly, sugar exposure or giving children anything dipped in sugar. For example, even pacifiers are used, or adding sugar to the milk which is given to the child. These are all these are all this all may lead to cavities to develop in the little one if oral hygiene is not maintained. So this is the most common issue with children are facing. Three out of four children face these issues. Apart from cavities, bottle feeding has also shown to cause crooked teeth in children, and these signs are visible as early as age 3. There is also orofacial disorders that set in because of bottle feeding. Because when the child is being fed by the bottle, the child uses his cheek muscles instead of his tongue, because of which there is a different swallow which the child learns as they grow up, and that causes more issues in the jaws of the child. Yeah. Apart from that, bottles are also and so cavities which are caused by bottles are, firstly, they're seen in the front teeth of the child. After that, you will see the cavities to start in the back teeth of the child. Initially, they start as white spots, which eventually become brown, and then you start seeing holes. So the moment you see teeth which have holes, you definitely need to get a pediatric dentist to look at it so that we can fill it and not let it progress further. Because if you wait for it to just go off on its own, that's not going to happen. Yeah. So I'm going to take a few questions which have been asked. So the first question is tooth decay reversible in babies? Okay, so So, like I said, when cavity starts, it starts something as white spots or white lesions. Now, these lesions are reversible. But the moment you see cavities, that is holes in your baby's teeth, that is not reversible. You need to get a filling done, and then it's all right. But if you think that it's something which is going to reverse by brushing or by giving any medicines, that will not happen. It depends on the amount of lesion, or sorry, the stage at which the lesion is or the cavity is. White lesions or just discolorations can be reversed by using certain remineralizing pastes. But the moment there is a hole, it cannot get reversed and it requires to get filled. My child drinks bottle milk at night, which would affect my child's teeth. So I'm not going to stop a mother from having the baby drink milk from the bottle. But yes, if you're adding sugar to your baby's milk, there is a higher chance of cavities. Also, after the baby has slept off, if you are not going to clean the teeth, the milk will stay on. When the baby falls asleep, the saliva, which basically cleans off our tooth surfaces, reduces, right? Even when we go to sleep, the saliva in our mouth is less. So when the baby's gone to sleep and you have not cleaned the tooth surface of the baby and the milk stays on, yes, it can affect the teeth and cavities can start. So can toddler tooth decay be reversed? It can't be reversed, but it can definitely be treated. There are a lot of parents who are very skeptical about, especially in COVID times, to go to a pediatric dentist and get their child's fillings done. Please understand, dentists are taking utmost precaution to ensure that the patients do not face any issues. So it is very safe. You must get it checked before a hole is made and before the child starts complaining of pain. Don't think just because they are primary teeth, they are milk teeth, they're going to fall off. They're going to fall off after 6-7 years. In that duration, if the teeth are lost early, children struggle with a lot of speech issues. They also struggle with, they get very conscious of how they're looking, and that affects them. Also, they're kind of the bite that the kind when we bite, there's a certain bite that we have. So children start developing a different kind of bite if there is a milk tooth is missing before it's supposed to go off. Also, a milk teeth is a kind of a it's a space maintainer. It's a natural space maintainer. So it guides the permanent tooth into its place. So if it goes off early, there will be issues. So the next question is, can decayed baby teeth affect permanent teeth? Yes, they can. Now, how can they affect it? Is firstly, like I was explaining, if the milk teeth is decayed or it has cavities, it will go off earlier. So if it goes off earlier, the space that it keeps for the permanent teeth is going to go away, and then your child might start getting crooked teeth, or the teeth will come in a different place from where it is supposed to come. The other way is there is a lot of infection which goes on to the jaws, and there are certain scientific studies which show that permanent teeth which erupt into the mouth can have cavities even before they've erupted. It's a rare case, but yes, it is possible. So milk teeth should definitely be treated. The next question is, how to fix baby tooths decay because of bottle feeding? How do you fix it? Maintain oral hygiene. Get a 6-monthly check done every time from your pediatric dentist, even if there are no issues. This is called preventive dentistry. So if you get it checked every 6 months, if there is a white lesion, your pediatric dentist will give you a paste which will help your baby's cavity which has started to reverse. But if there is a hole, you need to get a filling done or get a checkup done. Hi, Jocelyn. My child is 3 years, has 4 teeth, which have become completely black. He didn't have his. Okay, will it fall? All right. Okay, so your child is 3 years, and 4 teeth have completely gone black and it's gone. So this is a very common sign of baby bottle caries. If this has not yet fallen, or you're not sure if it has fallen or it is there, please go to a pediatric dentist and take an X-ray. So when we take an X-ray, we'll be able to see if the roots which are there inside the gums, so you can't see them without an X-ray. If the roots are still there and the tooth can be saved, I will advise you to please get it saved, because at 3 years the child is still, if the roots of the teeth are still there, it can definitely be saved. And if it has fallen, there are ways to give child a kind of a artificial teeth in the place, so that the child is not conscious of the space which the missing teeth creates. So please go and have a consult with a pediatric dentist. Okay. So there was a question on my Instagram page about the foods that children eat and does that cause decay. So the kind of food, if the food is sticky, if it stays on the tooth surface for longer duration, there are higher chances of decay to start. However, if you're giving whole foods to the baby or even to your toddlers, whole foods are easier to wash off. They also have self-cleansing properties. So it's less chance of cavity to set in. So give your child whole foods. So when I say whole foods, it should not be processed foods. The other benefit of whole foods is that it ensures that the jaws of the child develops. It also helps the child to learn the correct swallowing pattern, which they develop when they become from infants to adults. Yeah. The other common question which was asked to me by email was, if tooth decay is there in a mother, can it happen to a baby? So I think it is a fantastic question, and I don't know if many moms know, but definitely if mothers have dental decay, there is something called vertical transmission, or you can basically there is a higher chance of your baby to get cavities. So I practice mother dentistry, where we look not only at the child's teeth but also at the mother's teeth. So if there is a cavity or if there is any issue with the teeth, we ensure that her smile is also protected, and at the same time we give the guidelines which are required for babies and infants and toddlers, so that you do not have any issues with decay. We also, breastfeeding is causes less decay than bottle feeding. It is really stated that if you breastfeed, there will be more cavities, but that's not true. If you breastfeed, there is definitely better development of the jaws of the baby. But at the same time, if you're breastfeeding and not maintaining an oral hygiene, there will be cavities which will occur. So oral hygiene, I think, is the key takeaway point that you all should have. Okay, the next question. Um, 2 years. Okay, so she's unable to walk. So I would suggest, please go and meet a pediatrician. A lot of children take a longer while to start walking. Do not worry. I'm pretty sure she will start walking. Yeah. Hello, doctor. I want my son to leave bottle feeding. What should I do? Okay, so that's a very difficult question, I think. Each child has their own journey of leaving the bottle. I think I'm somebody who does not recommend parents to really throw away the bottle one fine day, because children will really not eat, and then that will be a bigger problem. So to wean off any kind of feeding practice, I think you've got to balance it out. So you can start by giving the baby other foods to eat. At the same time, he or she still has the option of the bottle. Slowly, maybe out of 7 days in a week, maybe 2 days you don't give the bottle at all. And then you increase the number of days you don't give the bottle to the baby, so that the child basically starts, I wouldn't say forgetting the bottle, but other interests are developed. So the child gets used to eating other things. So when he or she starts getting used to other things, they don't miss the bottle so much. Also, they are full, so they're not hungry. So when they're not hungry, they will be happy and they will not trouble you about the bottle. You could try this technique and let me know how that works for you. Okay. The next question. Just scrolling, give me a minute. Okay, the next question is, I see pits on my child's front teeth and the back teeth has become black. All right. So like I stated, when you feed your baby, the first tooth which is in contact with the bottle is the front teeth. So that is the teeth which are maximum affected, and they turn brownish black, and then they start breaking up. After that, when the baby is actually feeding, if you will see, the milk touches the last tooth or the back teeth, and that's how that becomes black. So this is a classic pattern of baby bottle tooth decay. If your child does not have pain, you should go and see a pediatric dentist so that treatment can be done. If it is still a very borderline case and does not require pulpectomy or basically root canals in children, you can apply certain gels which will arrest the decay or the infection, and you will not have to go through the entire root canal process. But if it is a root canal, please don't be worried. It is a very common thing that is seen in today's children. So I would not say it is something to worry, but you should worry if you don't think of getting the treatment done. So please ensure you get dental treatment done for children, even if they're very small. This youngest child, a lot of people treat is even before they're 3 years old. So it is something you should not shy away from, but definitely get it treated. Okay. Next question. How often should I brush my teeth? How often should I brush my child's teeth? I'm guessing. Um, how often? Twice a day for 2 minutes, and after that you should not have anything for 2 hours. So it's the 2 cube rule that you should follow. Ideally, you should so it depends age to age. So when your baby is really small, 18, 19 months, and they have very tiny, small 3 or 4 teeth, or maybe six, what you can do is after they've eaten, you should clean their teeth with a gauze, because asking them to brush every time after a meal is difficult. So you can take a gauze, wet it in lukewarm water, and you can rub the surfaces off so that all the food that they've eaten is not touching their tooth for very long. Apart from that, morning and night brushing is a very important routine. So morning brushing, let the children do, but the night brushing should definitely be done by the parents, because it's they sleep off, and if any food is stuck on the tooth, can cause higher chances of cavities in the baby. Okay, next question. What does it mean by white layer on baby teeth? How long should I brush my kids' teeth? So when I say white layer, what I meant to say is the white teeth that you see is the enamel or the white layer. When you see white spots in your child's teeth, it means that that's the first sign of decay which has started. For how long should you brush your child's teeth? At least for 2 minutes. So that means you should ensure in this 2 minutes all the surfaces of the tooth. So, for example, if this is the tooth, the surface from which we chew, as well as the side surfaces, should be brushed. And if they let you brush for 2 minutes, I think you've won quite a battle. There are a lot of toothbrushes which have music. So the music plays for 2 minutes. So you play a game with your child. That till the music is on, you've got to brush your teeth. And it comes in so many shapes and sizes and colors that it becomes their own favorite toy, and they actually start using it more than required, and it becomes easier. Um, okay, so next question. Okay, so Pradeep has asked me a question. आपके बच्चे को अगर बुखार है and आप प्लीज एक pediatrician को दिखा. 23 weeks usually I would not say would cause any issue. Please show your child to a pediatrician. Especially in such COVID times, I would say if you can also do teleconsultation with doctors, because you don't, अगर आप नहीं लेके जाना चाहते अपने बच्चे को डॉक्टर के पास, teleconsultation से कोई भी क्वेश्चन हो, आप डेफिनेटली एक पीडियाट्रिशियन से पूछ सकते हैं. Okay, next question. Okay. Next question is again about reversing tooth decay. बच्चों के जो दांत होते हैं उन पे जब गड्ढे होने लगते हैं उनको रिवर्स नहीं कर सकते हैं, मगर जब सिर्फ दाग जैसा लगे या आपको लगे कि एक सफेद सा कलर हो गया है आपके बच्चे के दांत में, उसको हम रिवर्स कर सकते हैं। मगर जैसे गड्ढे हो जाते हैं दांत में, उसको आपको फिलिंग करानी पड़ेगी और वो अपने आप ठीक नहीं होता है, ना तो दवा से ना तो सिर्फ ऐसे ही ब्रश करने से। तो उसके लिए आपको डेफिनेटली डेंटिस्ट के पास जाना पड़ेगा ताकि उसकी फिलिंग हो सके। Okay, the next question. Extraction in teeth, is it important? Uh, Extraction of a child's tooth is not something I really propagate. Magar agar if the tooth cannot be saved, you may have to extract the tooth and maintain the space with something called a space maintainer, or we call it the ring of the child. Lot of times we try and do procedures which at least keeps the tooth in the mouth of the child till it naturally falls off. So extraction is not always the only solution. It can definitely. How does bottle feeding affect crooked teeth? Okay. So, I said at the beginning, bottle feeding causes crooked teeth because when the child uses the bottle to feed, the muscles that is used by the child is the cheek muscles. So, there is excessive pressure put on the jaws. So, when you do this, there is your child's jaws becomes narrow, and that is why जब दांत निकल के आते हैं वो आगे पीछे आते हैं. So bottle feeding से बहुत time crooked teeth होने का there's a higher chance of having crooked teeth. Okay. I think I've answered all the questions. Lastly, I want to say, apart from keeping your child's teeth clean, there's also something called fluoride therapy, which is there. So there is fluoride in pastes. There is also fluoride that dentists do in their clinic. So that therapy strengthens the tooth of the child and reduces the chance of decay. It is literally a 4-minute procedure. जो हम gel लगाते हैं, and it stays on the teeth for 4 minutes. And the shelf life or this treatment is a 6-monthly thing. So every 6 months, you just have to come to the clinic and get a fluoride shower done. So it increases the strength of the tooth and reduces decay. What paste should you use? So in children under the age of 2, you should use something called a training toothpaste, which basically teaches the child what a toothpaste is and how to spit the toothpaste. After your child has learned how to spit the toothpaste, you can move to a fluoridated toothpaste, which is available at a lot of stores, and it's very there are so many flavors and so many names. But you should just check the contents. So before your child has learned how to spit, usually I would not recommend to use a fluoride toothpaste. After that, you can. There are also various sizes of toothbrushes depending on the age of the child. So the idea is that the toothbrush should reach the last tooth in the baby's mouth. So you start with a 0 to 2-year-old toothbrush, and then you keep graduating as and when your child grows. Okay. So I have answered all the questions. If any more questions, please feel free to reach out to me either on email through BabyChakra, or you could find me on Instagram. Lastly, I would really like to thank BabyChakra for this opportunity, and I hope I've been able to help mothers in this lockdown. Thank you so much.